This podcast is for informational purposes only and does not dispense medical advice. Always seek the advice of a physician or other qualified health providers if you have any questions regarding a medical condition. Never disregard professional medical advice or delay in seeking such advice because of something you have heard on this podcast. Welcome to a show that we like to call Prostate Cancer Real Talk. Did you know that in the U.S., 1 out of every 8 men will be diagnosed with prostate cancer during his lifetime? 1 out of 8. And black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. But hey, we're not here to quote statistics and tell you how tough prostate cancer can be. Rather, we are here to create a supportive community of survivors. A place where we can discuss the real-life coping methods from the perspective of a married couple who are living through it day by day. Our hosts, Elle and Shay. This is Prostate Cancer Real Talk. In this episode, Prostate Cancer, Research and Clinical Trials, we are pleased to welcome Dr. Natalie Reizine. She is a physician and researcher in the Division of Hematology and Oncology at UI Health and the University of Illinois Cancer Center. As a medical oncologist, Dr. Reizine specializes in treating genitourinary cancers, including prostate, kidney, bladder, and germ cell tumors. She strives to be her patient's advocate and to facilitate shared decision-making. Dr. Reizine's research interests include developing and designing clinical trials to improve personalized treatment approaches for cancer patients. She studies how genes impact patients' response to medications and therapies, and she hopes to reduce her patients' toxicities to treatment while maximizing their therapeutic benefits. Elle met Dr. Reizine in his role as a paid external advisory board member for UIC's Cures Within Reach focus group, which is committed to increasing the engagement of underserved patients via this clinical research trial. Elle and Shay, take it away.
Thank you very much, Dennis, for that wonderful introduction. And Shay and I are very, very pleased to welcome with us Dr. Natalie Reizine.
We can say Natalie, but it's Dr. Reizine. Hi, Dr. Reizine. Welcome to the podcast.
Thank you so much for having me, Ellen, Shay. And yes, please call me Natalie. It's really a pleasure. It's really a pleasure to be here.
So, Natalie, before we get started, why don't you give us a little bit more on your personal background? We've heard that great introduction from Dennis, but give us your personal perspective on where you are and how you've come to this point in your career.
Sure. Thank you. Thank you so much for that kind introduction. So I actually, did not plan to go into medicine originally and ultimately decided to be an oncologist back when I was a teenager when my own father was actually diagnosed with cancer. He was diagnosed with a type of lymphoma and then ultimately passed away from a type of brain cancer. This was a very challenging time for my family. And we got through it because of a couple of reasons. My older sister was actually in medical school at the time, and she really was an advocate for my family. And I realized that I really wanted to be an advocate like that for other families. So I first became interested in medicine in that perspective. And then I came to see my father's oncologist really as what a doctor is and what type of doctor I wanted to be. So I kind of made the decision to go into oncology from that patient perspective and then never really looked back. In terms of being interested in prostate cancer, so that really started once I came to work at UIC. So I did all of my medical training in Chicago. It had become my family's home. And I was very excited about UIC because of all of the colleges that are a part of the university, the College of Medicine, of Dentistry, of Pharmacy, Public Health, because I knew that I wanted to be a clinical researcher. So I thought that environment was a great place to do team-based science. And it certainly has been that, in particular, taking care of my prostate cancer patients, both as a clinician and then also as a researcher.
My personal perspective and experience with UIC, I was invited in October of 2022 to be a part of a panel, a tour, so to speak, of the Cancer Research Center. And the subject was science for equity, what equity looked like in the lab. And the great thing that I remember about that experience was not so much the technical aspect of the tour, but meeting the scientists, the researchers, and really getting a feel for their highly personal commitment toward finding a cure for treatment and cure prostate cancer. So the facility itself was wonderful. It was great. But even more so was the experience of, we had lunch together with them. And it was just a really great experience to see what's going on and see the dedication of the team there at UIC. So why don't you tell us a little bit about the project, this research project that you're a part of, Dr. Natalie. Tell us about that.
Oh, sure. I mean, I think I'll go back a little bit into the background, so thank you so much for sharing that. I mean, I've been fortunate to be involved in a couple of experiences like that, and I hope to be involved in more. And I think, I'm predominantly a clinician at heart, but at UIC, I've really been able to, I hope, what I really want to do is connect the patients to the clinical research opportunities.
So why don't we delve into the study itself? Tell us a little bit more about, and we're going to call it licorice root. I think you have a big, long, fancy name for it. Tell us a little bit about the study itself, the clinical trial, what its goal is, and what your role is in it.
Absolutely. So yes, glycyrrhizin, also known as licorice root. So ultimately, I've become incredibly interested in the role of integrative or complementary medicine in cancer patients. When I became an oncologist, I was asked by my patients over and over again, now that I have prostate cancer, what does this mean for my life? What should I eat? Should I take anything? Should I exercise, etc.? And I think this is really important, culturally, but I also, and I would be interested to hear your guys' perspectives, I also think from my personal experience that it gives patients and their families a sense of control over what can feel like a really uncertain time period with a new cancer diagnosis and embarking on a new treatment. So I was very interested in studying a modality of this form. And then I want to hear from you, but then I can get into my particular interest in licorice root.
So when I was diagnosed, and I'll say we, because this is a shared experience, and that's one of the things that we address in this podcast. And Shay was actually the brains behind the whole podcast idea, because when you are diagnosed with prostate cancer, or I would imagine a cancer of any form, you really are in sort of like a fog. Okay, you don't think clearly. You're not going through all the analytical thought processes that you would think that you would normally go through. So it's really good to have somebody there with you who can really be cognizant of what's happening and not have that emotional tie to just trying to deal with this mentally. Oh my God, is this really happening to me? Can this be really true? And you turn into internet junkie where you're looking for every possible reason that you can to make this not be true. But as Shay will tell you that eventually you have to face the reality that it is you. As far as lifestyle is concerned, you do understand that is going to be a change for you, but I don't think it really becomes clear to you the significance of the change that's going to happen. It affects not only you, but it affects your family. It affects your spouse, your significant other. And so, that whole process that you go through when you are diagnosed with prostate cancer, it's a new learning thing. And I was just fortunate to have a helpmate, I'll call her, like Shay, that was able to help me through this thing. And I will say, to our credit, I didn't panic. Did I panic, Shay? I don't think I did. What's your perspective on that, Shay?
So I would say, like you, I agree. You're in a fog. Like, I actually had no clue, like, what to expect. Elle was just like, immediately, like, I want surgery. He didn't want to do radiation. And he's like, I want it out. I don't want any cancer in my body. I want to have the surgery. So we just went with that. We never really took the time to, like, say, okay, what does this mean lifestyle wise? Like, what's going to happen? We just knew that he wanted the surgery. And so even like the day after when he was discharged with the catheter, I wasn't aware that he was going to be coming home with that. So we didn't focus a lot, which you're just like, I was in total disbelief. I couldn't believe that he had cancer. So I guess we just didn't pay attention maybe, or we didn't research enough to understand what was going to happen after surgery, post-surgery, what to expect, and the things like coming home with the catheter, or like how long he's going to have it, or, you know, like his lifestyle. Will he be able to exercise right away? Like maybe changing his diet, just all kind of different things. You know, would there be like, you know, like they said in the hospital, you know, when you're going to have leakage after the surgery. We didn't know any of that. We were just so focused on the surgery itself and having the prostate, having the cancer, you know, basically removed and having the prostate taken out. We didn't take the time to, you know, think about the lifestyle until post-surgery. And then it was like, whoa, you know, so we had a wake-up call.
I do want to mention one key factor when you're deciding between surgery and radiation. Okay. Now I do remember this cognitive decision that we made when the doctor told me, my surgeon told me that if you have radiation, the prospect of surgery down the road, let's suppose you have radiation and it is successful in arresting the prostate cancer. But then if it comes back, the likelihood for a surgical option was pretty much off the table, that it would be a very difficult procedure. I guess it can be done, but they call it salvage surgery, I believe. So that was a key decision maker for me, was the one-way street for radiation. So I just wanted it kind of done.
No, I mean, I think what you guys are, you know, mentioning is just really, you just kind of have to get through it. But you were really fortunate to have such a great advocate in Shay to help you get through that. And I hope the same for all of my patients.
I'm curious, so we are curious about the study itself. Can you get into that a little bit and tell us a little bit more about the clinical?
Yeah, absolutely. So Dr. Jeremy Johnson, he's wonderful. He is a pharmacist and a scientist. So he has a lab at UIC, and he's actually an expert in studying natural compounds and supplements as treatments for several diseases, including cancer. So when I became interested in studying integrative medicine and prostate cancer, and particularly licorice root, I approached him as a collaborator to help find a company that manufactures licorice root or glycyrrhizin in a reproducible and safe way, and a process that was actually vetted by the FDA. And this study is actually designed to study the effects of licorice root in prostate cancer with that specific compound.
So the licorice root, when does it come into play? If I'm a man and I go to see my doctor and he or she tells me that my PSA levels are elevated, and whether it's surgery or whether it's active surveillance or whatever the protocol is for treating it or observing it, when does this licorice root come into play?
So that's a great question. And that's hopefully what we will start to figure out with signals from this clinical trial. So licorice root is an ancient compound that's been used for thousands of years in different societies for anti-inflammatory, detoxification processes, lots of different things. And I first became interested in it because of another collaborator at University of Illinois, Dr. Gnanasekar Munaratnam. So I was very interested in this, you know, as a traditional medicine, and maybe repurposing it in our prostate cancer patients now. Particularly for this clinical trial, there are many different types of clinical trials. And, I sent you some resources about the different phases of clinical trials because it can be quite complicated. But this particular clinical trial is actually what's considered a window of opportunity study. So in this particular case, it will be patients who, like you, were diagnosed with localized prostate cancer and have made the decision to go on for surgery. Okay, so that's kind of the decision that they've made, is that they're going to get the prostatectomy as the treatment for their cancer. This is a window of opportunity trial because in between the time where the patient and their families have made that decision and they're scheduled to get the surgery, they will take the licorice root compound for a period of about a month to up to 6 weeks. It should not delay their time to surgery or any standard of care treatment. And it's a short period of time to look to see what effect this compound has on different specimens, including the prostate tissue, as well as blood specimens that we'll be collecting.
Okay, so there's a specific protocol of individual that this clinical study is targeted to, and that is a person who has been diagnosed with prostate cancer, who has decided to have surgery, the prostatectomy. And this window of opportunity occurs between the time that the person is diagnosed and then the time that the surgery is scheduled. And so during that time, the patient would take this licorice root that they would get from the source that you will identify for us. And then prior to that surgery, they will get some tissue samples or some type of testing will occur to assess the success or the status of the impact of the licorice root regimen that have occurred during that window.
That's exactly right. Yes. And what we hope to do is layer this into the patient's standard of care treatment. So we'll look at the biopsies that were taken as standard of care to diagnose the prostate cancer. And then the patients will consent to donating their prostate specimens after the surgery for additional analysis of, exactly as you said, we'll be looking at the levels of licorice root in the prostate cancer, whether or not that changes important genes, the expression of genes that we know are important in prostate cancer. And from a more global perspective, we'll actually see if it changes the prostate-specific antigen, the PSA levels as well, along with a number of other things. And this type of clinical trial is done because it's a short period of time. And if we can show that this is safe in prostate cancer patients and maybe has some exciting signals, some exciting biomarkers, then we can move it forward and into your first question, which was, where does this ultimately fit into prostate cancer treatment? Mm-hmm. And then I would be very interested, again, with your help in the Community Advisory Board, in studying this in a longer term intervention.
I have a question. So I know the listeners, they're hearing this and they're probably wondering, like, if I start taking the compound that you're recommending, the licorice root, and you're saying it's pretty much a 4 to 6 week window leading up to surgery, there are probably some listeners or, prostate cancer patients right now that may be saying, well, can I do maybe 8 weeks or 10 weeks in hope that I actually don't have to have the surgery, and perhaps this licorice root can basically kill off the cancer and I could, save myself from surgery? Is that a possibility, or is that something you guys are looking at in the study?
So that's a great question, Shay, and thank you for bringing that up. So in the study, the patients are still getting the standard of care for their cancer, which is to get the prostate cancer removed. Okay. Right. We will be looking for signals and biomarkers to see if it is looking like prostate, like licorice root has the same role as it does in the laboratory. But ultimately, what happens in a human person is very different. So that's exactly what we're trying to start to figure out. I would caution listeners certainly not to start taking licorice root outside of a clinical trial. If you ever look at herbal supplements that are in the stores, it actually says on the label that this is not recommended to diagnose or treat any specific conditions. So that's why we're being very cautious with choosing a compound which we know is pure and reproducible, and actually studying it in the indication of prostate cancer where it has not been studied before.
So, as we were preparing for our discussion with you, we did some research, reading, and we found that this particular approach to licorice root hasn't been taken before. That this is a somewhat of an inaugural study on this particular topic. Can you tell us how that came about, and why is it taking so long for this approach to be looked at?
So I think that's an excellent question. I think probably in your reading, you saw that it is a very common herbal supplement to much of the world. I actually think that when you look back historically at what we use in conventional medicine, a lot of our standard therapies actually did come from traditional medicine. So paclitaxel, which is one of the most commonly used chemotherapies, actually comes from the yew tree, which is an evergreen tree that's found in the Pacific Northwest. So I think that there are a lot of researchers looking to these traditional type medicines to inform and maybe even repurpose in new study designs. In the terms of licorice root, I was very interested in this topic, both because of my relationship with my patients, where I was repeatedly asked, what should I do now that I have cancer? How does this change my life? Is there anything I can take? And I realized that this was very important to my patients. And then I was very interested in addressing that question from a very rational, traditional compound that actually does have some preclinical evidence for treating prostate cancer, once again, in the lab, not in humans yet.
Just a reminder, to ensure that you stay up to date on the latest episodes from Prostate Cancer Real Talk, don't forget to hit that subscribe and like button.
Okay, so my inclination when I was reading about licorice root, as we prepared for this study, I was like, I got to get some of that stuff. Okay, so for our listeners, okay, I've already had prostate surgery. I've had follow-up. My PSA levels have been, thank God, 0, which is what we want.
Wonderful.
But at the same time, I'm like, this sounds really great. Why don't I just get some of this licorice root as a preventative step to reoccurrence? So can people just start taking licorice root to ward off prostate cancer or prevent it from coming back?
That's one of the questions that I would be interested in studying it in the future. So if I see signals or biomarkers that look promising in this short window of opportunity, and I can demonstrate that it's safe and tolerable in prostate cancer patients, that's exactly that exact space is where I would be very interested in studying it in the future, because I think that would be something that like yourself would be very interested in. I think many patients would be, because it gives them control over the illness. But first we need to do our due diligence and make sure we see some activity and also that it's safe. And that's the point of our clinical trial.
Okay. So don't run out and buy licorice root at the local vitamin store.
Not yet. No. And I would recommend listeners that if you are interested in different herbal supplements, always talk with your treating provider about what you're interested in taking, because we do know that these herbal supplements, like I said, they've informed a lot of the standard chemotherapies that we have. So they're powerful substances that can have side effects. So I think it's always very important to discuss with your provider what medicines you're taking and what supplements you might be interested in taking to make sure that the dosage is correct and that it's safe.
Right.
I recommend that for all of my patients.
So Dr. Natalie, you mentioned the term biomarkers several times. So could you please describe that and how that plays a part of the clinical trial that you're involved in?
So PSA is technically can be considered a biomarker. So it's basically a biomarker is some type of signal that informs us of what's going on beneath the surface with the cancer. So in this specific clinical trial, we will be looking at a number of different biomarkers like PSA. We'll also be looking at other hormone markers like testosterone, different inflammatory markers and growth factors, and then also changes in gene expression within the prostate cancer itself to see if we can give a clue as to how licorice root may or may not be interacting with the prostate cancer.
You mentioned testosterone. What relationship do testosterone levels in men have to PSA levels and prostate cancer in general?
That's a wonderful question. So there's actually a very significant relationship. When I'm a medical oncologist, so I normally get involved with the care of prostate cancer patients after it's become more advanced than in your case, Elle. And we talk about treatments that are systemic or go everywhere in the body, because at that time, the prostate cancer, unfortunately, is more advanced. So our treatments need to go everywhere in the body. A mainstay of treatment for advanced prostate cancer is to lower the testosterone levels, as we know that testosterone can, especially in the early stages of prostate cancer, can lead to prostate cancer growth. So one of the main things we will do for patients is called androgen deprivation therapy, or lowering the testosterone level. Licorice root actually has some evidence that it also helps to lower testosterone levels, which is one of the things we will be looking at in this clinical trial.
Thank you for listening to this episode with Dr. Reizine of the University of Illinois Cancer Center. Make sure you join our next episode where Dr. Reizine discusses more about clinical trials and prostate cancer. To reach our show, email Elle and Shay at prostatecancerrealtalk.com. That's EL and Shay, SHAY, at prostatecancerrealtalk.com.